Sonoanatomy of spring ligament. Another name is calcaneonavicular ligament. So what is this ligament? This ligament is found between calcaneum and navicular bone. It actually supports the medial longitudinal arch of the foot. And why it is important? It is important for foot stability and it prevents the overpronation. Has three components of three groups of fibers. So superomedial, inferoplantar and medial group of fibers. With ultrasound, we can only see the superomedial component of the calcaneonavicular ligament. As far as the position is concerned, it doesn't matter whether the patient is lying supine on bed or he is sitting. The medial side of the foot should be accessible to us. And probe, we need a preferably high frequency probe and linear probe. So when we are examining for the this spring ligament, now if the probe is having a broader footprint, then we will be able to see all three bones. Like this is the sustentaculum talli, and this is talus, and this is the navicular bone. But if the probe is footprint is smaller, then we will see only two bones, so talus and calcaneum. Now while doing ultrasound, we will first target this tibialis posterior tendon just behind the medial malleolus. So these tendon, then gradually when we come distally just below the medial malleolus, then this tendon we will see as a oblique view. This is neither short axis nor long axis. It is an oblique view, and then we will put the probe in a parallel to the foot plantar surface, parallel to the plantar surface. So this tibialis posterior tendon is also visible, and mainly the talus bone is visible. So over that, this area is nothing but the spring ligament. This is the spring ligament, this is the spring ligament. Actually, between the tibialis posterior tendon and spring ligament, there is a gliding layer of loose areolar tissue or fat. But this gliding layer is not always seen if it becomes difficult to distinguish if the probe is not that high frequency. So, but this is the location where we should search for the spring ligament. We will see the tibialis posterior tendon. Gradually we will come distally and we will see this tendon in a oblique view, because we will put the probe in a parallel direction to the plantar surface. In this picture you can see the proximity of this true structure. This is the posterior tibialis posterior tendon, and this is the spring ligament or calcaneonavicular ligament. So the of course when viewing by ultrasound this ligament, we will be able to see the tibialis posterior tendon also. So while examining, we have 2 points to find this ligament under ultrasound. One is we shall be focusing on tibialis posterior tendon, and second point is keeping the tibialis posterior in view. We will gradually rotate the probe so that probe becomes parallel to the plantar surface. We will start from the medial malleolus portion. So here we can see this is the tibialis posterior tendon in a short axis. From here we will gradually go just below the lateral malleolus. So as soon as we just go below the lateral malleolus, and we are still seeing the tibialis posterior. Now we will just rotate the probe in a direction which is more parallel to the plantar surface. So we can see the spring ligament here. So this is the spring ligament. This area, when Tom, Dick, Harry, we know that this is Tom, this is digitorum, Dick, and this side is Harry in this area. So what we are seeing in Harry area, so this part is completely talus. As I go down, then only this calcaneal, which is the sustentaculum talli which comes. Okay, this is the sustentaculum talli and hairy remains here. This is the area of hairy. Okay, so I have seen the sustentaculum talli here. Now, when I am coming like this, moving just below the malleolus, then what I can see? I can see two things. One is I already know this is sustentaculum talli, and then I know that this is the talus. So navicular has to be here in this area. So now I can see the navicular. So this is navicular. In between this is talus and this is the sustentaculum talli of calcaneum. What is this? This is nothing but the tibialis posterior, because as I told you that it is neither long axis nor short axis. Okay, so this is the tibialis posterior. Now you see where is the spring ligament. Spring ligament is between calcaneum and navicular. So do you see something here, just here? Try to match with the picture. So this is the talus, and just above that, this is the actually spring ligament. This is the tibialis posterior tendon. So between them, between this tendon and the spring ligament, there is the gliding layer. This gliding layer is nothing but the some fat layer. So join Asian Pain Academy to learn MSK ultrasound in depth and become more confident while doing the pain procedures.